Cardiovascular system or blood vascular system is composed of a muscular pump, the heart, and the tubular system, arteries that carry blood to organs and tissues, and veins that return the blood to the heart. Tubular system. Blood vessels are different in size, distribution, and function, but structurally are composed of three major coats. From the lumen outward are tunica intima or interna, formed of endothelium of simple squamous epithelium, subendothelium of loose connective tissue, internal elastic lamina of elastic fibers located between the tunica intima and the tunica media. Tunica media consists of smooth muscle fibers with some elastic and collagenous fibers. External elastic lamina may be detected between the tunica media and the tunica adventitia. Tunica adventitia is formed of loose connective tissue with some elastic and collagenous fibers. Types of blood vessels. Arteries that carry blood to the tissues and organs of the body, classified into large elastic arteries, example aorta, medium-sized muscular arteries, medium-sized specialized arteries, example basilar artery and coronary artery, small arteries or arterioles. Veins that carry venous blood to the heart are also classified into large, example inferior vena cava, medium-sized and small-sized veins. Blood vascular system. Examples. An example of large-sized elastic artery, aorta, examined by the naked eye and low power. Basilar artery, an example of a specialized medium-sized artery examined by low power. Medium-sized artery and vein, an example of medium-sized muscular vessels examined by low power. Aorta, an example of large elastic artery. When seen by the naked eye, it has a thick wall and a wide lumen. By low power, it is formed of the usual three coats: tunica intima, tunica media, and tunica adventitia. Tunica media is the sixth layer and is very rich in elastic fibers. So, the internal and external elastic lamina are not clear, cannot be easily distinguished. Tunica adventitia consists of loose connective tissue and contains vasa vasorum for nourishment of the thick vascular coat. Basilar artery is a specialized medium-sized artery. Is a small size, having thin wall and wide lumen, like the veins. The wall is composed of the usual three layers: tunica intima, tunica media, and tunica adventitia. Tunica intima is characterized by well-developed internal elastic lamina between the intima and the media. Both media and adventitia are thin layers. Medium-sized artery and vein. The artery has thick wall and narrow lumen, formed of the usual three coats: tunica intima, tunica media, and tunica adventitia. The artery has apparent internal elastic lamina with thick media and thin adventitia. The vein on the other hand, has thin wall, wide lumen, and may contain some blood inside it. Its wall is the usual three coats: tunica intima, tunica media, and tunica adventitia. But there is absence of internal elastic lamina with thin media and thick adventitia. Medium-sized artery and vein. The artery has thick wall and narrow lumen, formed of the usual three coats: tunica intima, tunica media, and tunica adventitia. The artery has apparent internal elastic lamina with thick media and thin adventitia. The vein, on the other hand, has thin wall, wide lumen, and may contain some blood inside it. Its wall is the usual three coats: tunica intima, tunica media, and tunica adventitia. But there is absence of internal elastic lamina with thin media and thick adventitia. Other blood vessels. Inferior vena cava, an example of large-sized vein, examined by naked eye and low power. Coronary artery, an example of a specialized artery, examined by low power and high power. Inferior vena cava, an example of large-sized vein. By the naked eye, it has thin, irregular, collapsed wall and wide lumen. By low power, it is formed of the usual three coats: tunica intima, tunica media, and tunica adventitia. It is characterized by the absence of the internal elastic lamina and thin media and thick adventitia, containing bundles of longitudinal smooth muscle fibers. Coronary artery is a specialized artery. By low power, it has thick tunica intima, thin media, and adventitia, with well-developed internal and external elastic lamina. By high power, the three usual coats can be easily seen: tunica intima, tunica media, and tunica adventitia. Tunica intima is thick, lined by simple squamous epithelium, containing bundles of longitudinal smooth muscle fibers in the subendothelial layer. Tunica media and tunica adventitia are thin, with well-developed internal and external elastic lamina. These elastic lamina are important to prevent occlusion of the vessel during contraction of the heart, the systole.